All right, what's up, everyone? Today is December 28th. Um, I know it's super late. I kind of forgot to do it on the 19th. And then every day it's just something I'm meaning to do the update video, but then I don't remember until it's late at night. So I'm like, I know it's super late. Um, but I was like, let me get this in just to have it done. So there's no more delays because I know it's like literally over a week after the 19th. But if you have been watching the journey so far and you saw the last video, so that would have been week 12, and so that was day 82, week 12, December 15th. And then so today is December 28th, technically, like super early in the morning, but let's just keep it consistent with what it actually is. So December 28th. Um, and so that's 13 days later. So I think that'd make that, day 95. So this is day 95, almost at the 100 mark, but, just past 3 months basically. So to recap, September 25th is when I had my surgery. Christmas, so Merry Christmas to all of those you celebrate and Happy Holidays. It just passed, but December 25th was the exact 3 months after. So 3 month mark is I'd kind of say like the first big milestone in sort of what's generally a year recovery from the surgery. And like I'd said in the last one, I'd give an update after the follow up, which was supposed to be about a week ago, but um, you know, better late than never, right? So this is not going to look too different from before. Every time I go, they do repeat X-rays. So I got X-rays again. This is what I was shown. So there's the humerus. There are the two screws. There's the socket. You can like see it's my rib cage and stuff. So right shoulder, and that's what it looks like. You can see the spacing is pretty consistent. So really, really quick visit. I mean, this guy's like really busy. Really just kind of go there, wait like 30 minutes, 40 minutes. Sometimes it could be as long as an hour just to get 5 minutes of him to like check, and then you're out. But really all that happened on December 19th, that day, last Thursday. He just had me put my arms kind of out. He said over my head and then off to the side like this. And then I think they were down by my sides, like just down below. And then he just said, he showed me these X-rays I'm showing you, and then he said, yeah, like this motion out here, like the whole kind of stick thing, and like that external rotation from when you're seated and your arms down. That's like the last to go. He said, I'm trying to recall everything because it's pretty short anyway. He said the bone is healed. So 3 month mark, if you get the surgery, 3 months roughly, bone is healed. And then what he said is like the ligaments, muscles, tissue, all that soft tissue is about 50% of what it will be. Um, and so the next follow up won't be until 6 months post op. So that is March of next year because we'll be going into the new year here pretty soon. Um, and then he said basically for restrictions, because I had that 2 pound restriction, so there's no more 2 pound restriction. He didn't really give me a weight restriction, which is kind of weird in my opinion. Because obviously, it's 3 months out, but it's still only 3 months out, and it's not like I can just start benching 2 plates, right away or anything. Um, Not really sure why he didn't give me any sort of number, but like, because I actually asked, I'm like, so what's the weight? What is the weight restriction? Because he didn't tell me proactively. And basically, all he said is like, there's no weight restriction, but like whenever you're doing like a pulling motion, like when you're at the airport and pulling bags off baggage claim, it's just don't yank stuff. Do it slow and controlled. So how I took that is basically don't lift anything that causes pain. So I've kind of given myself like 15, 20 pound weight restriction, and that's just overall. But of course, lifting something down here is going to be a lot easier than lifting something up here. So that's kind of the you know what 3 month follow up, I guess. Nothing's really changed. This was December 19th X-rays, the one from the follow up. Like, this is from the November 7th. Okay, so they're just doing X-rays again and again. They're like a little bit different views. Oh yeah, that was November 7th, and this was August. This was August 1st, so before surgery. Yeah. November and December. I should have September somewhere in there, or October. I mean, yeah, there's October ones in there too, but I guess I can show them if anyone's curious. But this was in October, so I don't know. They keep on showing me, I guess, different views, maybe just for their sake of looking at what needs to be looked at, but also not overdoing X-rays where you're getting charged like $300-$400 every visit because you're getting all these X-rays. But that's the follow-up. In terms of PT, I am doing a lot more stuff than before when I go to the clinic. He did, so I guess after the most recent follow-up before this one in December, so the one I was thinking November 7th, I did actually get one of these slips from the surgeon. This is like the little prescription you give to the physical therapist. And this was before I took that 2-week hiatus, basically, do my military training and all that. And I do remember, so I start off, 3 times a week. And then after that first follow-up, after like the first and second week follow-up, so that was the 6 week. Yeah, 6 weeks. So the November one. So from the 6 week mark to the most recent 12 week, technically it was only 2 times a week. He gave me the prescription, but I kind of forgot to give it. And I also sort of wanted to do a little bit more before I go on those 2 weeks break. And then now he actually only has me at 1 time a week because I'm supposed to be doing, at home every day, which I did start doing the past 3 days. So I know I haven't been great about that, and I'm open and transparent about it because that's honestly the hardest part, in my opinion, is staying disciplined and accountable when you're not, in PT and stuff like that. Because that's where it's just, it's boring. No one wants to do it. And especially when you've had like 6 years of it not really helping you at all, you're not going to be motivated to do the same thing over and over again. Because I've done way more than just logical PT. I've done like Eastern Chinese medicine and putting like freaking colored dots on your fingers because there's something called color therapy that, like, obviously all this sounds like stupid, but when you've done everything, you'll pretty much do anything to get fixed, right? So especially for me, definitely the hardest part, but like I kind of noticed. So this is where it's probably not a big deal, but it still concerned me. I was saying like basically here is the goal for the 3-month mark, right? That's what my PT would say. You get full range of motion at three months, which I was kind of thought was pretty surprising, but I can't say I'm quite there. I'm almost there. But see, look, this is 180. And this is where I'm at. So I'm not quite, but it's close. Now, this could be partially because, I wasn't 100% perfect on doing PT at home and all this stuff, but it also could be just everyone's recovery is different. I've had, 20 plus subluxations, 1 failed surgery already before, and basically a very long time of my shoulder not being in the right spot and, sleeping on it, all the multiple injuries, the compensation, my anatomy of my whole kind of posture has probably changed, all that. But my PT hasn't told me anything concerning. Some guy told me he got all his range of motion back in like 4 weeks, which is insane. So you can kind of see here, I'm just kind of stuck right here, but I am all the way up here, which is obviously way better than week 1. Now it is really tight still. It's all kind of just in the joint, but if I just kind of show you, trying to show all the ranges of motion I can to give you awareness of my limitations, but also the mobility I have. So it's always going to feel pretty tight until you're getting really at the end of recovery where like you're just moving a lot, using it a lot. Now I'm not perfect by any means, but the goal is you want to be moving no matter how slow, but just be moving. Progress. And just today, like I have all these tremors when he's like stretching my shoulder joint out. And so I have like these little tremors in my hand and like twitches, and I don't think it's the most common. I'm assuming it's just because my shoulder has so much like trauma just in the sense of trauma to the joint, like it's had injuries and stuff like that. So like my brain is so protective of even it moving in certain places that it's just rapidly firing random stimuli like in the nerves and muscles and stuff like that. And there's the weakness from the cutting of the tissue and everything. And he's saying like, obviously it's still working, but he said it's better, that those tremors and stuff are still there, but like, it's much better than before. So to me, I don't notice it as much. To me, I'm always constantly kind of focusing on the issues and the problems because I just want it all fixed. But to him, since he's the one not seeing me on a daily basis where I'm just seeing marginal improvements, but he's seeing me like on every few days or every week. And also this is his job. He can notice it better than I can. So that's the update on that. I do want to give a PT update, but sorry, it's so late. I can't really give too much I can't. I mean, I can give a lot, but there is so much that it's just kind of boring. But I can just give a little bit of examples of like now I go in, I don't do my kind of the retractions and the shoulder shrugs and the heat. Nope, I just go straight to the arm bike. So I'll do 3 or 4 minutes of arm bike forward and back, which I've done this before in the past so many times. But for those of you who never had shoulder surgery, this will be what you'll probably advance to. So you're just going to warm up the joint, warm up the muscles. Then I'll usually do some pulleys. So like I've mentioned before, pulleys. And a lot of these will be like 3 sets of 10, 12, or like 15. Whenever it's like reps. Like pulleys is just time. But then it's like shoulder extension, these things. And so before I used no weight, now I use 1 pound. Internal, external rotation, extension, bands. Take a ball, up, down, up, down, up, down, side, 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 circles, back and forth, like 20 repetitions, 2 sets of those. Not really doing the towel slides anymore. I did a really weird one where today was a completely brand new one where I had a band that was on my kind of arm here, and then another band. So I'm pulling up doing this, but with 2 bands. So a band to this retraction and retraction up. And then I'm still doing the stick in this direction, 45, and then now 90. This one is kind of painful and pretty hard, but that's what I think will give me that last little bit of range of motion. And then yeah, he's doing his thing with I also do kind of the retractions while laying down, face down. And then he does his thing of stretching out. But yeah, that's the 12-week follow-up mark, PT update, range of motion update. Let me know if you have any questions. Other than that, thanks for watching. I'll see you in the next one.